Welcome to our weekly COVID-19 update. I'm joined today by MPP Amarjot Sandhu, who's going to share an update on some of our pop-up clinics. Also, City Councillor Paul Vasante, who has a good news update on our bylaw enforcement efforts. And of course, Dr. Lawrence Lowe, who is leading our public health efforts as our medical officer health in Peel Region. I want to start by saying I'm very encouraged by the progress we are seeing with vaccinations. We've always said that vaccines pave the way to get back to normal, and we're seeing the evidence of that on a daily basis in Peel Region as case counts drop and drop and drop. I am very heartened to report that we now have a positivity rate of 3%. Now, to put that into context, we were at 22%. We were at a staggering 22%, and to have a positivity rate this low takes us back to last summer, where, of course, we didn't have the type of community spread to diminish like we had during the third wave. So these are very encouraging numbers, and really speak to our ability to reopen, to move ahead with a stage 2 reopening, and I'm optimistic that these conditions that are being presented will certainly be consideration for an earlier reopening of stage 2. Having said that, I want to continue to encourage everyone to get vaccinated. The reason we're in this great position is because of the vaccines have changed the narrative in Peel Region. And so please, if you haven't got your first dose, get your first dose, get your first vaccine. And if you haven't got your second vaccine, please go and get your second vaccine. As the vaccine clinics across the GTHA move to offer Moderna and Pfizer interchangeably, don't hesitate. Make sure you get the first appointment available. You know, I hear some people talk about that they want to hold out for one particular vaccine. These mRNA vaccines are safe, they're tested. Jump at the first opportunity to protect your family, your friends, and your neighborhood. I can tell you, personally, I got my second dose last week. I interchanged vaccines, mixing in an mRNA vaccine after I got AstraZeneca initially, and I was relieved to know that by getting that vaccine, I'm protecting my family, my friends, and neighborhood, and I would encourage everyone in Brampton to do the same. Sign up and get your second vaccine as soon as possible, and we've got lots of appointments available, lots of opportunities to get vaccinated, and you're going to hear a little bit more about that from MPP Sandhu shortly. Effective today, individuals who live in Delta community hotspots, which Brampton is one of those, can book their second dose appointment for COVID-19 vaccines at a minimum of 28 days after their first dose. And that was shortened from the original 16 weeks. So there are more and more people that are eligible to get their second dose. This means that anyone in Osler's catchment area who received their first dose is now, before May 30th, is now eligible for their second dose interval. If you want to book your vaccine, simply call 905-494-6685 or go to your My Osler account, and that's if you're booking through the hospital. Of course, you can also book through public health. And I just want to reiterate, the Moderna and Pfizer mRNA vaccines are interchangeable, and Osler strongly encourages individuals to maintain their appointments because we do know, as we made great progress getting the positivity rate, there are still variants out there, and the best way to make sure it doesn't spread and catch hold in our community is to get vaccinated. I also have another update from the team at William Osler, and I can share this from Dr. Naveed Mohammed, who runs the Osler Health Clinic. The picture at Brampton Civic is getting better and better. Only 14 COVID-positive patients in the hospital and 2 in ICU. Now remember, our ICU was jam-packed before. The fact that we're down to 2 is really, really encouraging, the lowest number we've seen since March. So Brampton, we're making great progress. And on that note, I'm going to ask City Councillor Paul Vasante to share some good news on the fact that we are seeing broad compliance with our public health measures, and he's going to share a first in our community.
Thank you very much, Mayor Brown. Yes, good morning, everyone. It really is my pleasure today to be here to relate to everyone in the community that we have had the best week here in the community of Brampton. Since the beginning of the pandemic in March of last year, we have had a week where bylaw officers have not laid a single charge here in Brampton. And this demonstrates the collective commitment of our community and their dedication to help us all to move forward and get through this pandemic and into a place where we are in recovery and reopening. So I want to thank everyone in the community for continuing your hard work and to do your part in keeping the positive momentum in Brampton going. Back to you, Mayor.
Now, we've been talking a lot about the importance of getting vaccinated, and now MPP Amarjot Sandhu is going to talk to you about some of the new opportunities to get vaccinated at pop-up clinics in Brampton. In a previous press conference, we had Kamal Kara, the MP, talk about different ways the federal government was helping out, and now we're going to hear from one of our provincial representatives. One thing that has really been helpful during this pandemic is that we have a Team Brampton approach. MPPs, MPs, city councillors, everyone pitching in together. By the end of the day, we just want to get our city out of this difficult pandemic. And I just want to say, as mayor of the city, I'm grateful that from every partisan perspective, from every level of government, that everyone is pitching in to help. And Amarjot Sandhu has been an example of that, always eager to help on any issue that we raise at the provincial level. So MPP Sandhu is going to share with us an update on the new pop-up clinics.
Thank you so much, Mayor Brown, for inviting me. My name is Amarjot Sandhu, and I'm the Member of Provincial Parliament from the Great Riding of Brampton West. It is so wonderful to see how the residents of this amazing city have contributed to bringing down COVID numbers by following the guidelines suggested by public health authorities. Kudos to each one of you for your incredible efforts and support during these challenging times. The Government of Ontario, City of Brampton, and all levels of government are continuing their efforts to not leave anyone behind by offering a variety of vaccination options across the system to remove barriers and reach our vulnerable residents and communities with lower vaccine uptake. This work is being done in conjunction with numerous community partners. The Government of Ontario had a great focus on Brampton, Peel, and other COVID hotspots and helped in setting up vaccination clinics at various work sites to administer vaccines to employees and communities and helping the businesses when they need it the most. Worksite vaccination centers played a key role in securing the health and safety of communities in supporting the businesses in Brampton and Peel. That said, while we need to remain vigilant, I have a hopeful optimism that our community appears to be moving out of the acute phase of this pandemic sooner than later. We currently have Youth Pad at Century Gardens Recreation Center, Brampton Civic Hospital, and Applewood Heights Secondary School. We also have community clinic at Embassy Grand Vaccination Center and Sheridan College Davis Campus. And with incredible community partners like Ahmadiyya Muslim Jamaat Brampton, we're going to get another clinic up and running by the mid of July. Dear Bramptonians, as mentioned earlier, the best vaccine protection that you can get is the one that is available to you the soonest. I understand that for some people, that may mean getting a second dose of vaccine that is different than your first. In Peel's context, with historically high COVID rates and as a provincially identified Delta variant area of concern, it is critical that those who live or work in Peel get their second dose as soon as they're eligible. Public health authorities have suggested that letting the same vaccine for the first and second dose or mixing brands for first and second dose is safe and provides effective protection from COVID-19. Getting 2 doses is one of the most important things you can do to protect yourself, your family, and community from COVID-19. I thank you again for this opportunity to talk to you, and I also thank you for your continued support. Thank you so much.
Thank you, MPP Sandhu. And as you heard, we have pop-up clinics everywhere in the city, so there's no excuse not to get vaccinated. They're easy, accessible, and it's about protecting your family, friends, and neighbors. Next up, we're going to hear from Dr. Lowe on public health's efforts in Peel Region.
Yes, good morning. Thank you, Mayor Brown, Councillor Vicente, and MPP Sandhu. This week, Brampton's test positivity is at 3%, with a weekly incidence rate of 24.5 cases per 100,000. Over 76% of Peel residents have received their first dose of vaccine, and as of today, 25% of our 18-plus residents have a complete two-dose series. We're also currently adding 150,000 doses each week, which represents approximately 10% additional coverage of our eligible population with second doses every week. These numbers are a testament to all the sacrifices that you have made through the pandemic and all the various measures that have brought our third wave under control, and all the efforts that you've made in getting vaccinated to prove our trends through till now. Let me be clear that the vaccines are an incredible feat of science. It's clear that they work and that they are safe and effective. And while they are paving the way for reopening, we do continue to remain vigilant, holding a healthy respect for the Delta variant and racing to get to 2 doses. The surges in Porcupine in the north and in Waterloo closer to home are a reminder that 1-dose protection is only partially effective against infection. And the science table is also clear that reopening depends on increasing 2-dose vaccine coverage rate while we slowly expand our circles. So my message today is simple. I encourage all of our residents to get vaccinated with 2 doses of any approved product as quickly as possible. Whether you are getting your first dose or your second dose, remember that mRNA is mRNA. The labels may say Moderna or Pfizer, but both are using the same technology to protect us. And by the way, the labels also don't say dose 1 or dose 2, they say doses. And that makes it simple. An mRNA vaccine for your first dose, an mRNA vaccine for your second dose, and if you got AZ for your first dose, any mRNA vaccine will do for your second. Just get any 2 as soon as you possibly can. If you don't have a first dose yet, please remember, either mRNA vaccine is the right choice. Our data shows that individuals who remain unvaccinated are at the highest risk of death and hospitalization. 1 dose dramatically reduces that risk. 2 doses seals the deal, and the 2 brands work in the same way to do so. In the past few days, we've experienced a shipment delay with the Pfizer vaccine. We know that more reductions in Pfizer are anticipated in July, and yet some residents with dose 2 appointments booked for this week have actually refused Moderna and its production and walked away. That's the equivalent of saying that you won't fly with an airline because it's not your preferred airline that has seats off an island that is sinking. You'd rather wait for the next available seat on your preferred airline, which could be weeks away. So I cannot say this clearly enough. Please take whatever you are offered. Like me, I think all of us want this acute pandemic phase to end. I received Moderna, and I know that I got an mRNA vaccine that is bioequivalent to Pfizer in its technology. Family and friends of mine have received all manner of different combinations, and they are now benefiting from 2-dose protection. So for anyone who's refusing a vaccine to hold out for another, know this. You are leaving yourself partially unprotected, your family partially unprotected, and you are prolonging our reopening efforts. I also want to remind you that whatever vaccine you get now isn't likely to be forever. COVID-19 is clearly here to stay. That means there will likely be booster shots and new products, and policies will be adapted in time to reflect practice. So remember that our vaccine supply has improved, but it remains finite. We aren't at a point yet, though, where we can be picky. We need to protect our community with everything we've got, and previous stocks of Pfizer helped us get our 1-dose coverage goal. Now our Moderna supply is growing quickly, and that will help us get to our 2-dose coverage goal and get to the end of all of this. But in order to do so, I need you to remember that mRNA is mRNA. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. On that note, we're happy to take some questions. I see first up is Denise from the Canadian Press.
Hi, thank you for taking my question. My question is for Dr. Lowe. I'm wondering what Peel's plan is to reach people who have not yet gotten their first shot.
Yes, thanks, Denise, for the question. One of our vaccine program's goals that has been recently restated has been what we call the last 25%. How do we reach the last 25%? So we have a number of mobile and community outreach clinics that have been started. We are going back into workplaces where not just second doses but also first doses can be explored. And we're looking at other ways to reduce barriers to access, both ethnoculturally as well as in terms of timing and availability and places of vaccination, to ensure that everyone is offered not only their second dose for those who are looking for a second dose at this point in time, but also everyone for that first dose, which is so critical to reducing death and hospitalization. Thanks for the question.
And my follow-up, Mayor Brown mentioned that with the decreasing case numbers and high vaccination rates, he thinks that reopening can be earlier. Do you agree with this?
Yeah, thanks, Denise, for the question. You know, certainly our view at the region of Peel is that each additional week is buying us 10% protection of our eligible vaccine coverage in our community, as I mentioned. However, there is a recognition, of course, that the measures have been in place for quite some time and have impacted many businesses and members of our community. Those sacrifices have paved the way for this reopening, and certainly I think there are ongoing discussions, as I understand it, as to whether this can proceed ahead sooner rather than later. Regardless of what happens, my encouragement to our residents, though, is to continue to remain vigilant, to ensure that they get 2 doses of vaccine, and to make sure that they are gradually expanding their circle and their contacts. Thanks so much for the question.
Our next question is Sabrina from the Mississauga News.
Hi there. So my first question is for Mayor Brown. So I recall last week you were pushing for the opening of personal care services earlier than July 2nd. I'm wondering if you're still doing that as they're set to open next week.
Yes, I'd love to see them open today. I've continued to plead with the province that this sector has been hit really hard. I'm hearing positive responses from Queen's Park that they're actively considering this, and I hope it comes soon. I really believe that it's time to let people get their haircuts, and this is a sector, and we've seen 20% of these businesses go under. It's tough, and I want to see them back on their feet.
Thanks. Okay, so my second question is for Dr. Lowe. So there was a couple of reports about the Delta variant in Peel and how I believe it said that it doubled in the last week. I'm wondering if that is concerning, if Peel Public Health has expected that large increase, and sort of where we are in Delta being the main variant.
So thanks very much for the question, Sabrina. Certainly the proportion of cases that are accounted for with the Delta variant has continued to track along what the science table had indicated, becoming the predominant variant in our region by the end of June. But that said, it is a proportion of positive cases, and we do know that our transmission levels and our test positivity have continued to increase steadily as our vaccine coverage has continued to climb. So I think it is a matter of really it's in our hands to continue to get to 2-dose coverage and to make sure that as we're reopening, it's not time to pack the social calendars right away just yet, but it is time to maybe let loosen the interactions, the opportunities to see family and friends, preferably outdoors, you know, certainly making sure that everyone is vaccinated and sticking to precautions, opening up gradually as we manage to add 10% of coverage on second doses. You know, again, 10% a week means that by the end of July, we will be at very significant levels of coverage, at which point perhaps we can entertain broader reopening measures at that point in time. So it is about reopening and engaging again gradually while ensuring we all get our 2 doses. Thanks so much for the question.
Our next question is Nitin Chopra from Prime Asia TV.
Thank you, Mayor Brown. My question is to Dr. Lowe. Dr. Lowe, in some countries, including India, the Delta variant, after more mutation, it became Delta plus variant, AY01. So do you have any concern of Delta plus variant here in Ontario or in Canada? Because a few days ago, we saw a Delta variant outbreak in Toronto Western Hospital. Thank you.
Thanks, Nitin. I don't know. I understand from the reports at Toronto Western Hospital that they were confirming, but they suspected that it would be the Delta variant. It wouldn't be surprising, certainly, given the number of cases that were involved. It is important for me to highlight, though, that regardless of what variants are being discovered at this point in time, at this time there is good evidence that 2 doses of vaccine coverage protects against the variants that are currently in circulation worldwide. That may change in the future. That's why I referred to things like boosters and new products that may need to be taken at a later date. But for now, the focus really should be on getting to 2-dose coverage to ensure that you're covered against any potential variants that may be circulating in our community. Thanks for the question.
Thank you. My next question is to Mayor Brown. Mayor Brown, today, 23rd June 2021, is the National Remembrance Day for the victims of terrorism. 23rd June 1985, 36 years ago, the biggest terrorist attack happened on Canadian soil, perpetrated into Canadian soil, Kanishka Air India bombing flight 182. 329 passengers, including 22 crew members, 136 children below the age of 18, they were died. Is City Plan anything to pay tribute to those victims? Is Team Brampton has any plans to pay tribute? Is City plans to put flags on half-mast on city buildings? Thank you.
Yes, this is a day we recognize annually in the city of Brampton, as is the case in the province of Ontario and the government of Canada. It's a somber reminder of this unimaginable tragedy with the Air India bombing, the largest loss of life in a terrorist event affecting Canadians. And the city issued a proclamation that will be read out at City Council, proclaiming this day a day of remembrance in the city of Brampton. So thank you for that reminder of that sad chapter in our history. Our last question is to Nikki Cedrone from the Bramptonist.
Hi, good morning. My first question is for Mayor Brown. Northwest Brampton has seen many neighborhoods go up along Mayfield Road west of Highway 10. Do you know when Mayfield Road will be expanded?
Yes, so thank you for that question, Nikki, and I do have that information. Mayfield from here, Ontario to Mississauga Road construction starts in 2023. Mayfield from Mississauga to Winston Churchill construction begins 2024. And the Region Appeal is currently working on land acquisition and utility relocates. It's anticipated that process will take place in 2021 and 2022. But that project is well underway, and the residents should have confidence that that infrastructure investment and upgrade is going to happen very quickly. Is there a follow-up question?
Yes, for Dr. Lowe. For those who've chosen not to get vaccinated, will there be long-term implications like not traveling, attending public events, or simply eating in restaurants?
Thanks so much for the question, Nikki. I think certainly we can look to the experience of other countries on this, and ultimately the decision to enter a private property like a restaurant. Again, I'm not a lawyer, but I understand that that is ultimately to the proprietors to make decisions as to what will permit entry. And so I think we do know that the most important thing that I can say in respect of getting vaccinated is to ensure that you get to 2-dose coverage as quickly as possible. And so I can't stress it enough. It's certainly 1 dose of vaccines has been shown to be nearly 100% protective against hospitalization and death. And 2 doses of vaccine really seal the deal and really ensure that we'll also see reductions in transmission that will keep all of these places that we want to get back to open. So it's a very good question. Thanks, Nikki.
Okay, well, thank you for tuning in today. That completes our COVID-19 press briefing. Thank you very much to MPP Amarjot Sandhu for joining us as a special guest today, Regional Councillor Paul Vicente, Dr. Lowe for his unwavering dedication, and to Paul Morrison and his team at Brampton bylaw for that encouraging report that we didn't have a single bylaw infraction this week. It shows there's a wide appreciation for the public health guidelines, and that the job bylaw on public health has done educating the public has certainly paid dividends. We're making great progress, Brampton. Let's keep it up.